It's time for 2 for 2 Shades Pink. And it's me, that girl T, and my beautiful co-host, Lisa Johnson Smith, who's the original host of BET's Teen Summit. Join us for part 2 of our engaging interview with the beautiful Shonte Drakeford. Thank you for always sharing your story and being so ecstatic and upbeat about, sharing it.
Yeah. It's true. Like when I found other people that lived longer, it did give me hope, And when I started doing like advocacy, like maybe like a year after diagnosis, because it wasn't a lot of people that were young and I was seeing. I was a lot of no offense, older people, and they were like traumatizing me.
I know. She said it like looking at us. Well, I know Lisa's younger than me because
yeah. It's just a different category. We're the forgotten group. It's always the peds and then the people who are over 45, and I'm like in the middle. And then like they were telling me all these horror stories, and I was frightened. And then I met some people who were metastatic that were young, but not a lot of Black people. So I was like, I gotta get my voice out here. People have to see themselves in me, and I have to, because I feel like it's my destiny. God put me on this earth to do this. And my performance was unique because it was me. I went to HBCU, and I was in a band. I've been in a band since elementary school. That's my thing. And I was like, this is easy. This is something unique that I know everyone doesn't have, that skill set. And so my girlfriend helped me with the routine. And like I was like, bam, bam, bam. I still got it, because this is a very physical thing. A very physical thing.
But it's a year later, so can you tell me if anything? I mean, tell us what's different now since your story. Has anything changed with your treatment or with your life that you want to share? I know this is COVID time, and I know Lisa has some questions centered around that, so we'll kind of segue into that.
Yeah. So I'm 5 years officially, so I'm very grateful for that.
Yay.
And I'm still on my first line treatment. So what happens when you're metastatic, you have treatments, and the longer you can stay on the medicine, the better. Because like I said, it's a terminal illness, and you go through these medications and treatments until nothing works. So some people could only get that treatment for 3 months. Some people could only get it for 6 months. Some people get a year in what we call progression. So I get scans every 3 months to make sure the cancer hasn't spread. So it's already spread. We're trying to keep it at bay from spreading further. And so I get scans, and my scans have been very stable. The tumors are always present, but it's not getting larger, and it's not in new spots. And so that is a blessing for me. I'm still stable in essence in that way. I haven't progressed. I'm still on my first line treatment, but COVID sucks. I broke my foot, like I mentioned earlier, trying to, I was watering onions. Not a cool story, but I was watering onions. I'm very fragile because of my bone metastasis. And I broke that little baby bone on the top of my foot. I was in crutches for 2 months. So COVID plus crutches put me into almost like a depressive state. And I had started palliative care to talk to my doctor. Palliative care isn't because you're going to die, but I've been living with this disease for 5 years, and the goal is to keep my quality of life. So I have to redefine what quality of life is for me, because I am at home and I had to stop working in the clinic. I'm a nurse practitioner, a primary care provider, and there was too much of a risk because my immune system is so compromised. I will get ill from this COVID and potentially die, especially since I have tumors in my lungs. And so I had to stop working there, which made me sad, because I love, like, being a nurse gives me purpose still. And although I work 1 day a week because physically I can't do more, that was my joy. So now I've been put home to telemedicine, which is not the same. And my hours have been reduced to only 2 hours a week. And now I'm having this dilemma of my doctor's asking me when I'm coming back, and my oncologists are like, no. And I'm like, well, I have to find a happy medium. I don't want to get laid off, right? And I also want to still help, but then I got to be decked out, right? So I don't get ill. And then it has caused major anxiety because before COVID, I always was already cautious because that's the lifestyle you live when you got cancer, right?
Yeah.
I already had a mask. I traveled with a mask when I was on planes. This was my norm. But now it's heightened. I'm terrified to touch anything. And like I'm boosting my immune system twice as much as I did before. I can't see my friends like I used to. I have to do all this virtual stuff, which I hate. I thrive off people's energy. So it's just a hard adjustment. So I started doing more hobbies. I started working out 5 days a week now. I've lost 14 pounds.
Wow.
Yeah, I'm much trimmer than the show.
you were thin. You were thinner than all the rest of us.
Yeah. And that actually has helped my immune system too. But it gives me a purpose to get up and do something physical. It helps me move. I do have hypertension now. Unfortunately, not because of my diet and exercise that is lacking. It actually bettered. But because of the medications I take, the cancer drugs I take, increase my risk. And I already have it in my genetic pool. My mother and my father, a lot of comorbidity. So I was just tinkering a borderline. And I don't, the medication I'm in medical menopause. And so that increases my risk for blood clots. That increases my risk for hypertension. And that's the last thing I need to worry about is me getting a heart attack because of the medicine I have. And I have to get a colonoscopy again. So every 5 years I get colonoscopies because I have a genetic trait for colon cancer, which I found out when I did my genetic panel when I got diagnosed.
So are the most of the drugs that you are on, are they trials or are they known drugs, or are you asked to be part of trials to try new things, or have you ever been?
When I first got diagnosed, the medication I'm on, I'm not sure if I'm allowed to say which ones they are.
Okay.
But to you, I can say which ones I take. Is that okay? Okay. So I take the medications I'm on was just recently FDA approved, and I was offered a clinical trial in the beginning, but my doctor thought about it and was thinking about my main goal is quality of life. So people typically think you get chemo. All drugs are chemo, right? They're chemical therapy drugs, right? But the way is the format, right? So I didn't get IV chemo, right? And I didn't get a mastectomy because, again, quality of life, and there isn't enough evidence to show that getting mastectomies will decrease the risk of spread, right? It's kind of equivocal, but some people feel better about getting their breasts removed because they feel like the tumor is gone. So I got started right away on oral therapy. So I've been on the oral medication, and then I had to get radiation in my hip and my rib for like 2 weeks, every day for 2 weeks, and I was on crutches for 5 months.
So I have 2 questions for you. One, I'm shocked that you said you did not get a mastectomy. And 2, gosh, I forgot the second question. I don't remember to answer that first. I'm surprised. Was it multicentric?
What do you mean by multicentric?
Was it just one tumor or was it numerous?
Oh, so it was one.
Oh, it was just one tumor. That's why. Okay.
And it was one, and then it was one in my lymph node.
Okay.
And my doctor was like, he offered it to me, but I felt like I want to do the least invasive approach, right? Because, and honestly, the medicine I took, I felt the shrinking of the tumor in like 2 weeks. And now you can't even feel the tumor at all in my breast. It's asymmetric, like one is way bigger than the other. And it's my, calcifications on my scans. But like the actual tumor, to me, it felt relieving because it made me know that it's working. But it is an option, but the test, like the evidence shows that it's not required to get. Because it's already spread. It's already in your bloodstream. It could attach anyway. So why get an unnecessary surgery that will cause all this pain?
Right. And yes, I get it. My second question is, you talked a lot about how sometimes you get really down and all that. And I just curious, your husband and your family, what are they doing? A lot. They're saying that when you get cancer, your family members get cancer too. So what is he doing? What are your family members doing so that their spirits continue to stay high?
So my husband, like when I got diagnosed, he was like, because I was so optimistic, the way I presented, right? Mm-hmm. So, you know, the way I presented was, yes, I got this cancer. Yes, it's going to suck, but we're going to get through this and it's going to be okay. So the way I presented it to them, of course, they're going to be sad. They're going to cry. I think that was the worst part of the diagnosis, is telling my family and friends. And you have to absorb all those emotions because their instant thing is to cry. And right. I'm not doing that. It's not. And I was told I was in denial, like legit. They was like, you're in denial because you're projecting your feelings on me and the way I react, because you didn't want, like, I had a family member get mad at me because they was like, well, what if you have to get your breast cut off? Okay, that's fine. It was not fine. It is fine, because right. What I'm going to do? What can I do? I can't control this. So I don't want to expend all my energy in the crying and the negativity. And it got to a point where I was telling my husband, I'm like, you're going to have to take some of these calls, explain to yourself. And he's married to a nurse. So he understands medical terminology. He know how to break it down. So he was a very, really good asset. But, it's hard for them. But then, they forget now because it's been 5 years. They forget that I have cancer. In the beginning, it was like, oh, I'll give you anything. I'll support you, right. Whatever you need. And I'm still struggling. I still tired. I can't clean my house. I still don't be feeling like cooking. Things like that. I still struggle, but they forget because I look so well and I, in essence, doing so well that it's. And then they get to, sometimes family could be a little daunting, right? Yeah. Because they still think you could do the same things that you used to be able to. Mm-hmm. Right. And it's hard to convey that to them. Like, no, I just can't come and pick you up whenever you want, or I can't just get this for you when you want, or call on me to give you this, do this, and run this around. Even though I still be trying, but I am like the person in my family that's the person that people go to for help, yeah. Right? And my husband and I are that. And my husband is very stoic. He's military, so he doesn't express his feelings, but I could tell because I know him when he's scared, right? Mm-hmm. It's been moments.
Do you see a counselor or a therapist or anything, or do you encourage your husband to talk to somebody?
My husband was like a no-go. He don't want to do that. But I didn't at first. Now I'm seeking it more so because of COVID. So mm-hmm. I'm looking for a therapist now to kind of go through those things that and I talk to, I have support groups. It's not that I'm not doing support at all. I go through different support groups. I have a metastatic breast cancer support group. I got a young people support group that I go to. I have we call breasties. So mm-hmm. people who had cancer understand what I'm going through. Yeah. They're like, when I need to vent, cuss, or they understand, and then I even have someone who almost have identical breast cancer as I do. Mm-hmm. And understand what I go through and the pains and things. And we just chat and I vent that way.
That is so important. I mean, personally, I was diagnosed in 2014 with invasive ductal carcinoma, just like you. And I'm, what do you call it when you're estrogen sensitive positive?
Yep.
And so I had the whole shebang, double mastectomy, chemotherapy, lymph nodes positive, complications, blood clots, the whole deal. But for me, the thing that really helped me was talking to other women. Mm-hmm. And I remember meeting one of my pastor's wives. She had the exact same diagnosis as me. And it was like we immediately connected. But just hearing her story and hearing, I don't know if you felt the same way, you guys, but I wanted to hear every detail. Okay, well, what did you do with this? And how did you feel when this happened? And, what was your next step after that? And and that was so helpful. And I think for women, I feel it's like women just do a disservice to themselves when they keep it a secret. Mm-hmm. And, I felt that, I didn't announce when I was diagnosed either, because I was like you, I didn't want, the hardest thing is to tell your family members. Mm-hmm. Once I finished my chemo treatment, that's when I told, people outside of my close circle, but close circle were there for me. But it was so important for me to hear from other women. So I would encourage other women or people who are listening to this to tell somebody else so that you can hear from other people for that encouragement that only those people will be able to relate to, you know?
Yeah.
It's true, because you don't even like it's, and then also having like other people who went through it, they got those hacks that you don't know. Even if you just join a Facebook group, it's so many Facebook groups now that has support that has the exact same, even subtype of cancer that you have, and you can ask those questions that you don't feel comfortable with telling anyone. But like having like that outlet is very imperative, because you're just going to absorb it, and stress is not going to heal you, right?
Right.
You have to let it out. You have to heal within from out. And yeah, it's gonna be rough. It's gonna be tough, but you need someone to. I had someone on speed dial, almost like, right. So she had breast cancer and was a nurse, so I could relate. And when I had my panic and anxiety attack, I'm like, is this normal? Oh my God! Like she was like, it's more heightened when you're a medical professional, because I'm used to the one putting the oxygen on you. I'm used to the one putting the blood pressure on you and calming you down. Like, you doing that to me now? And then me knowing the numbers and the things and what those things mean, it just stresses me out.
Yeah.
Yeah.
Well, if there was something that you could change or a law that you could change to help women deal better, what would that be? Is it, I know for you, in your story, you mentioned something about adopting. Did that, your diagnosis affect that in any way, or anything else you want to share?
So like all of that, right? One with the adopting. So a year later, I wanted to still adopt. I was young, I was 32 at the time. We had failed infertility issues. I had endometriosis, which increased my risk of not bearing a child, and we wanted a child. And it was this misconception, even with infertility, you've been together forever. I've been with my husband since I was 15, and we don't have a child, right? And so they think like, you don't want children. And this is this assumption, and that wasn't the case. And I wanted to adopt an older child. I was a foster kid, and that was always in our plan. I don't want no baby. I was like, first, if I'm not pushing it out, we're going straight to school age. I'm not paying child care. I'm not pushing, I'm not paying for those sleepless nights. I want a baby that's ready to go to travel. I wanted to do that, but because I won't be in remission for 5 years at least. The adoption agency, even the ones that's oncology friendly, would not allow me to adopt, even though I'm in a 2-parent household and I was shown to be stable and my husband was stable. I know now that maybe, you can advocate a little bit more and get letters from your physician and show your stability. So you probably can adopt, but now I'm over it. I've accepted it. So you have to recreate yourself as far as like your career, and you have to know your rights as your ADA rights. You're considered disabled now, right? And there's limitations in certain things. Cognitive dysfunction is real. I have mental fatigue, and I forget things, and there's no way I could concentrate for more than 12 hours. I had to reduce my hours. I went back to school, became a nurse practitioner, but physically I couldn't do it. So I had to apply for SSDI. But the type of position I'm in, the SSDI, which is Social Security Disability Insurance, it does help some people. But for me, my salary, because of my position, is high. But you're giving me this amount that's very much lower than I need in a month. So it's still a cut. And I'm able to work at least a little part-time. But I think that the disability should match your income, at least like more than half. Like this was like a significant decrease. So, I have a working husband who was able to kind of, catch up. But some people don't get that luxury they still have to work, and work through the pain, work through the cognitive issues. And we need financial support, and people still have to pay co-payments and drug medications and things like that. So those laws need to be enacted to help us and aid us in medical insurance and all these pre-authorizations and discrimination against that. And even just quality of care, right? So my whole goal was to always work in a rural environment, work with my people. I came from DC, grew up in DC. I understand the environment of the underserved. And I wanted to be for my people, but now like it's even more so, and I do work in that environment. The quality of care specialists. There's no specialists. You know how hard it is for me to refer specialists, let alone oncology specialists. They don't live in my area. There needs to be some incentives to get these specialists out here so these patients are not traveling out. Like, and it needs to be later hours of the clock. I used to work night shift. A lot of providers get trained working night shift. We need to be able to at least to offer 2 nights a week to clinics, right? And these clinics, at least from like 5 to 10 p.m. for these working families who can't get off, who are at risk if they take too much time off to lose their job. And we also need clinics, just like dialysis clinics are all up and around underserved communities. We need little cancer center clinics and suites for us to go get our treatment and go back home and do our business just like they do with dialysis. Why can't we get that? Why we got to travel so far out? So I know it was a lot. I got more, but
I know you do.
you know, this is passionate for me. You know what I mean?
Yeah.
Anything else, Lisa?
If there was one piece of advice that you would give to someone going through any type of cancer right now, what would it be?
I think you, one, you're not alone. Don't think you're alone. Don't do this alone. I know it's hard to ask for help, but you have to let that barrier down. Because me, I'm a big, I got this. I'm independent. I don't need anybody. You do, though. And I think people who are caregivers and caretakers understand and process this for yourself. So you're not projecting so much emotion to that person who's going through it. They need as much positive and encouragement and motivation as possible. So check yourself and check your emotions. And also just know, your triggers. And if family wants to help, instead of asking us, what can I do? Just do it. I have an oncology masseuse. And she knew I was in pain. She's like, I'm coming this weekend to give you a massage. Just do it. Like, my friends know I can't stand doing dishes. They just come over here and do my dishes and fold my clothes. Like little things. It's hard for us to decipher what we need because I'm not going to ask you personally. And I'm not going to tell you. And I'm going to try to figure it out. And my husband's going to yell at me, you're doing too much. So if you're family, just do it. Don't ask. Just come up with something. Fold clothes, fix them a meal, clean the house. Anything, and also I just think, like, if you are going through this, use your resources. It's so many organizations out here that are in abundance to kind of help you get through what you need. If you need financial support, if you need moral support, if you need, I went through this place that sponsored our vow renewal. They're out here. They want to help. You have to use these resources. They have. Most of them federal funding. They have to spend the money. Let them spend it on you. You need car rides back and forth. Get them to give you a car ride. You need a meal. Don't be too humble.
Right.
Yeah.
Oh, prideful. I'm sorry. Be humble, not be prideful.
Well, didn't I tell you, Lisa, that she takes some lemons and makes some pink lemonade? But she made more than pink lemonade. Shonte, what's your favorite drink?
I don't know. What you mean? Like, what kind of drink?
You know what I'm talking about. Anyway, she know I know. She can take it and make it even brighter, even taste better, look better. You're just a joy, and I'm just so blessed to know you, call you friend, sister friend, and I'm just so happy that you were my very first guest, and that I made the connection now to Lisa. And we look forward to seeing you again, hearing more about what's going on. And I thank you. And Lisa?
Yes, thank you so much, Shonte. You are a bright light for so many.
Thank you.
So bright. Yes. So I'll leave you with, what's your shade of pink? And it could be any color. What's your favorite color? And why do you choose that color?
My shade of pink is every color because, it's a different variety for everyone. It's unique to you. And just like breast cancer, everything is unique to you. It's a unique diagnosis to you. You deal with it how you deal with it, but you got to deal with it the best way you can. And yeah, I have like all colors, right? I love them all.
Yes. Well, thank you so much again. We really appreciate you.
Thank
And
you.
Shonte is an advocate, and at the end of this, if she wants to share, if she loves to talk to other women, and if you want to connect with her, we have a way to do that, and we thank you.
Yeah, thank you. It's a pleasure.
Bye-bye.
Bye, Shonte.
Bye.
Thank you to G Natural Hair Products for sponsoring this segment. G Natural has the finest natural ingredients and essential oils needed to hydrate, moisture seal, and style your hair. Isn't it time you tried G Natural? Find out more and get yours at gnatural.net. But it was great. Her story's so powerful, isn't it, Lisa?
Yeah, she is awesome. Wow.
Yes.
Amazing.
And like I said before, we had 7 women in the play. I mean, we'd be here all night trying to interview them all, but we have another one that's coming up soon. And we have other things to share. Like, again, this show is just not about talk. We will be, showing you some things, some products that are out here that help through treatment or not through treatment, just things that you should know that make you feel better and bring you joy, as well as you'll have like some little bit of entertainment, enlightenment to make you laugh and bring you joy, as well as talking about what's hot, what's new. Take a look up at what's in the news, what's changed, etc. And my favorite part is community organization spotlight. Just like Shonte has mentioned, they're out there, but let's focus in on those Black organizations, especially the small ones out there in the street, the foots on the ground, making things happen that people never hear of. You hear of the big ones, but how about these ones who are really, really making a difference? We'll touch on the bigger ones, but we're going to focus on and spotlight them. So thank you.